Christine, we kind of started this off at workforce, and one of the other subjects you had very interesting, legacy facilities. So it ties in what Bikosh and how we started with just so many new modalities, higher speed, more complexity, and then you have these CDMOs with quote unquote legacy facilities that maybe did biologics or small molecules, and suddenly they're a cell and gene plant. I don't mean suddenly, but they're trying to turn it into a cell therapy facility. Again, you're working with workers who were in that legacy facility, and now they need different skills. So how does the industry move forward when a lot of things are moving to different modalities, such as RNA, as Bikosh said, or cell and gene?
Yeah, it's such a great question, and it's such a challenging one at that. What we've seen, or I could say that I've seen most recently, are in a facility, they had a legacy fill line, for example, and they had some sporadic contamination on that fill line. And we were just talking a little bit about that, Bikosh, I think you had mentioned. And then they started to see that sporadic contamination on that fill line in other products. So that, again, becomes a really big issue. And what they decided to do, it was interesting that they shut down the line. That was a hard decision for the CDMO, this one in particular, to make. Batches were put on hold. The workforce was stagnated right there because they didn't have a lot going on. And what they tried to do is re-clean the line and jigger the line so that it would work and that it would be better without serving or identifying the true root cause. So 6 months later, they go back to putting back in place the fill line that they disassembled and cleaned and whatnot, without addressing the root cause. And the same issue came up again 6 months after they had brought down that fill line and then brought it back up, where they could have engineered maybe a new room with automation to be able to control contamination or do contamination control strategies better with higher throughput and better capabilities, but they didn't. They really stayed with the re-engineered line without looking towards automation. And that took an additional 8 months once they decided to do that thing. Right. So instead of being down for 6 or 8 months, they were down for a year and a half, and that caused a lot of problems with the workforce and the longevity of the workforce because of the slowdown of the manufacturing site, particularly on that fill line, and it cost them money. So we talk about the cost of quality. You have to look at the preventive costs as opposed to just fixing the issue or just trying to band-aid an issue. And I think that does go back to the workforce. Now, we've also seen cases where people have been promoted, and I'm not sure if, Bikosh, you might have seen this as well, but we've seen people being promoted within an organization with not a lot of experience, not a lot of hands-on manufacturing experience, but they've been promoted because they stayed on and they've been like good soldiers and they've been good, maybe people managers, but they might not have that specific expertise needed to make these harder calls or to be able to advance exploration into new technologies and digitization. So, and that can cause some problems too. So the strategies that I would recommend is really do your homework when selecting the right CDMO. We were talking a little bit about it in the first part of the discussion, and I think, Aaron, you brought this up. Do you stay with one CDMO that you start with, who might be really strong in development in the research part of it through phase 1 and maybe get you through phase 2 when you get to 2B and 3, and when your expectations are much higher, will that CDMO be able to handle that and meet those expectations? So I think it's a really good question, and I think you really have to know the CDMO is best as you possibly can. And even offer yourself and your quality folks up as a person in the plant to sort of help out and coach, not to oversee per se, like in the strict old quality ways, but to be able to be a partner and coach folks on the floor. Let them know a little bit about the reasons why you have to have things done the way you do, that you want them to be done in
Mhm.
order for them to be done right.